Well, hello, Myra.
Hello.
How are you?
I'm doing well. Thank you. How are you doing today?
I'm good, thank you. It's been a long time since I seen you. I mean, the last time was probably maybe even high school, or I don't know if maybe we saw each other a little bit after.
Yeah, it has been quite a long time. I think way too many years to count, but I think it was since high school.
Yeah. And in high school, uh, you seemed like, well, at least to me, you seemed like a very disciplined person, someone that really focused on their work and their school and everything. And the person that tried to avoid, all the trouble. And and then I would, and then now you're, and then I mean, that was back in California, and now you're in Seattle.
Yes, I am.
How do you like
Yeah.
it?
I actually really enjoy it out here. It's a little bit, it takes a little getting used to.
Okay.
I don't think that a lot of people realize, I didn't realize myself, how much the gloomy weather can actually impact you.
Mm-hmm.
But I think I've gotten so used to it. I've been here for about 4 years now that I actually miss the rain when it's gone. So I enjoy the weather. You manage, and
Right.
a lot of people here are actually really good about having life go on when things are crazy outside and cold. But so I've gotten a
Right.
little bit more used to it, and I've enjoyed it so far. So I like it. I
So
like
it's
really.
almost completely different from California weather, huh?
Yes, big time. Very different.
Yeah,
It's very.
even like I don't know if you know, but I moved to Texas, and the weather is also completely different here. Cause here it's one whole day. It could be sunny and it can gloomy, and then it could rain all in one day.
Yeah.
And in California, it was just beautiful weather all day long. And
Yes.
I would tell my wife, in Cali, we were so spoiled with the weather, and you don't really
Yeah.
realize it till you go somewhere else, and you're like, what plans can you make outside? You don't know whether it's gonna be a sunny day or it's gonna be a gloomy day. And even like the gloomy days, I do know what you mean. When it's gloomy, you almost feel like just staying home and not do anything, right?
Right, absolutely. But and I feel like we took it for granted, the
Yes.
consistently sunny weather that we had back home. I really miss it sometimes. It's one of many things I miss of being home. So it's always nice to, whenever you're back there to just, remember why you love it.
Right, right. Have you gone back since?
Well, I have, I mean, not lately, I guess, but I definitely have gone back since moving out here. And it's always nice to, again, just remember everything that you love about home and realize that no place you go will ever be like it.
Mm,
So, there's that like nostalgic feeling anytime you are away from there, you think of everything that reminds you of home and family and friends and everything you loved out there. So yeah, I've gone back a few times, and there are, I think, certain things that I love to do when I go out there and like take advantage of all the good things that home
right.
has to offer,
Like why?
like In and Out, to name a few.
You guys don't have
In
any
and
now
Out.
with you?
What's that?
You guys don't have any now in Seattle?
No, the closest In and
Really?
Out to Seattle is one in Oregon. So that's still from here about a 2-hour drive. So it's not
Oh
super local.
man.
Yeah, but
Right.
that's one of a couple of things I would say. Then, some good tacos. You can't really have some good tacos out
Yes.
here in a lot of places. But also just go to the beach. There are actually warm beaches there. Out here, you can get a beach, but you won't exactly, have some warm weather to go with it. So
Right. And the closest beach is, I mean, a real nice beach would also be in Oregon, right?
Yeah, so so there's the Oregon coast, and then you also have the Olympic Peninsula here in Washington State. I would say both are, pretty unique and really have a lot to offer. If you love a lot of outdoor, recreational activities, both offer that. So it's really nice. It's good for camping, good for like riding bikes, anything you like to do outside.
Right. So what made you make the move to Seattle?
So actually, I was originally working in Honolulu, so I had a
Oh.
chance to work out there um, following a fellowship that I had completed, and my job, sort of the way that things went, I was offered a position here in Seattle. Prior to this, I was working a job that was a little bit more contract work,
Mm-hmm.
and so my contract of almost 2 years was close to coming to an end, and I was offered this position out here, which was a more permanent role. And so I said, I think everything's aligning right now for me to just go back home, or be on the West Coast still, obviously, but be back on the mainland, as they say it, and be closer to family. So I ended up moving out here
Right.
because of
Nice.
the job. Yes,
So how was it working and living in Honolulu?
it was a blast. I had such a good time out there.
I bet.
Yeah, and it's, everything you could potentially imagine it to be, but also it, I think, came along with some things that most people wouldn't really associate with it, but cost of living is pretty high. So while I loved it, it also is pretty expensive to live out there.
It's more
Um,
expensive than in California?
I would, I mean, arguably maybe not that much anymore, just because prices in California are a little bit, skyrocketing. But
Yeah.
I would say that it is definitely expensive.
Mm,
You at least can get like a decent sized, I would say how housing prices might be a little bit higher than what you normally could find out here. And, but I would
right.
say, yeah, for the most part, it's a beautiful place to be. Like the culture, the people, everything, it's just beautiful. I really do miss it.
Yeah, every time I think of like even any part of Hawaii, I just think of it as like a paradise.
Yes, you're not wrong. You're not wrong. Yeah.
What were you working on, or what were you doing? What were your responsibilities, or what were you doing? What were you working on at Honolulu?
Yes. So when I was out there, I actually was assigned there. I'm currently a public health advisor, and I work for CDC. And the position that I had accepted out there was actually a public health advisor role as well. And it depends on really what capacity I'm working in, that I could also be like wear multiple hats. So one is that I
Mm-hmm.
could also be a public health officer. And the
Mm-hmm.
reason for that being is because the branch that I work with within the agency is also has a little bit of a regulatory side of things. So you enforce public health laws, but also promote and basically provide guidance to state health departments and local county health departments. Of course, well, actually, in Honolulu, they only are run by the state health department, and but in other states such as California, there are county health departments.
Mm-hmm.
So that's really my role, is just to work with them and provide, guidance on outbreaks, guidance on, you know, what you normally would think of CDC as doing, which is providing some advice and recommendations, and managing cases and outbreaks that are travel related. So most of my work in Hawaii was working with the state of Hawaii, but also the outer islands, surrounding islands. So for the entire state, but also in like the um, Marshall Islands,
Mm,
Guam, American Samoa, and things like that.
right.
So it was nice working with a different group of public health partners that I hadn't ever worked with before. So it was a neat experience.
Very cool. And it's crazy because it almost Sometimes I even forget that Hawaii is part of the United States because
Yeah,
it's so distant, and
absolutely.
they they kind of have their own language and their own thing going on, don't they?
Yes, so there is definitely, the native Hawaiian language, which is actually, there are many people who speak it, but the population is relatively small of people who
Mm.
actually speak it. So there is a big push, I think, to kind of maintain it and ensure that it never gets lost completely. So
Oh,
generations who speak it, passing it down to the younger, generations and kind of pushing that forward. Um, so I think that uh, there definitely is, and just the way that the culture is embedded in everyday life really, I think, made it really special for me, and it's just unique in that sense. So you have a mixture of cultures, a mixture of languages. Um, so I think all of that was really what makes Hawaii what it is. It's
right.
such a cool melting pot of cultures and experiences. So I really enjoyed it.
Right. Now here in Texas, it's there's also a lot of rain, a lot of green, a lot of trees, and there's also a ton of bugs. And sometimes I'm even it's a bit risky because you don't know what is. Sometimes when they get on you, you don't know what's on you,
You just
and
know it's there.
yeah. And I would imagine Hawaii is even bigger in that sense because it's more of, more of a jungle. And was there like outbreaks of insects or outbreaks that were not common to, this side of the United States?
Yeah, that's a great question. So, when I moved there, had the opportunity to work on our Zika response. So,
Mm,
you all remember before COVID, before all of this happened, we were dealing with other things, and um, Zika in some places is endemic, meaning it happens and occurs frequently. It's part of their lists of diseases that happen in these areas that are tropical and that can find these diseases that are spread by different vectors, in this case mosquitoes. So yes, absolutely. So that was, I would say, the kind of the theme of most of my time when I was working out there was working on the Zika response that did impact most of the outer islands, and I would say most of not Hawaii, not as much, but definitely was still impacted. And also areas like Guam, American Samoa, and things like that.
mm,
They were definitely impacted by it. Um, so I had a chance to work on Zika at that time.
wow. Was that kind of your first project?
Out there, I would say yes for the most part, but I also mostly worked on um, disease outbreaks that were, I wouldn't say outbreaks necessarily, but cases of ill travelers, because the work that I do is mostly related to travel related illnesses. So, and surprisingly, actually works with a lot more like TB and things like that.
Mm-hmm.
So, while I did get to work on Zika, it was a little bit far removed in the sense that we were providing more recommendations and guidance, but more hands on. It was more, and like case and data entry was more for TB,
Mm,
as far as
I
what,
see.
yeah.
Now, and I mean, somebody with a regular job, even me with a regular full time job, you know, my responsibilities and duties don't really affect the whole economy or even all the states. And someone like you, obviously, the choices that you make and some of the advice that you provide has a huge impact. How does that feel, or how do you feel about that?
Yeah, so I would say, you know, I think that the role that I play is to kind of spread the information that a lot of, I would say, folks that are higher up in
Mm,
my division, in my branch,
mm-hmm,
develop. So what these scientists and different individuals who are working at CDC, medical officers, the expertise that they have and that they provide in order to kind of establish different guidelines, I'm on the ground and kind of implementing that and letting our
Mm,
partners know this is what we provide, this is what we
right.
recommend. So I do less of the development of that guidance, but and more so of the promotion of that guidance and enforcement. So because the work that I do, it is again enforcing more like public health regulations,
Right.
even ensuring that things coming into the US don't have the ability to spread diseases to us here locally. Now, I would say it's important to know, that public health is, kind of a broad area. So you can have
Yes.
um, different different vectors of disease in many different areas. So it can be in things that can be imported, and things that we consume. So we do focus a lot on enforcement of those rules to make sure that, again, we protect everyone's health here at different ports of entry.
Right. Yeah, and I mean even well before COVID, at least me, I had no idea that the CDC even existed. I had no idea.
That's probably a
And
lot of
then
people. Yeah.
yeah, and then once COVID hit, then you started seeing, even on like social media, as soon as you made a post or saw somebody else's post, you saw on there to go and click on the CDC guidelines. And I was like, oh, and come to find out that CDC's been around for years. And now because of pandemic, now it's been like just all over the place.
Yeah, definitely. And I feel that there's been a heightened awareness of what public health is. Before this, people didn't probably heard the words thrown around, but didn't think of what is public health.
Yeah.
And to this day, I probably can tell you that, people are still, we've had kind of like a shift in, okay, these are recommendations, and this is essentially what we can say is public health and guidance provided to everybody. But yeah, I would say that you're not the only person. I would argue that so many more have also, learned a little bit more about what public health responders and public health professionals do because of the
Right.
pandemic.
Yes.
Yeah.
So to CDC, what does public health exactly mean, or what do they try to promote as public health?
So I can speak for just, I guess, more so what my I guess I can just describe what I think public health
Hmm.
is, but it's basically um, public health is more, I would say, it's a mixture of things. So the way that I interpret it is a combination of interests and a combination of um, looking at different factors that impact our health and well-being. So if you look at a like a doctor, like a clinician, you're looking to treat. So there's a disease, you're going to treat it and provide somebody to, someone a remedy to improve their health.
Hmm.
Whereas public health is more preventative, and you want
Mm,
to prevent someone from having to get to the point of having to have an illness treated. But at
right.
the same time, public health is also public health administration, public health care. So it really encompasses it's a large umbrella of a lot of things. But public health is really prevention, it's epidemiology, so studying
Mm,
how diseases spread, patterns of disease, and also how to educate others on how to live healthier lifestyles, whether it's you know anything. If we think back to like the earlier stages of public health, anything, pretty much anything that we do today, it could be a result of public health efforts that have kind of shifted the way that we learn and live. So something as simple as seat belts.
okay.
Seat belts are one of the public health accomplishments that we can say have actually reduced the amount of car
Card debts.
deaths. Yeah, car accident deaths, and So, different things like that is what you can say define public health, are just changes in both policy, changes in like our behavior that can improve our health and well-being.
Right. And then is are you guys also in that spectrum of also natural disasters, or is it just diseases and viruses and bacteria and stuff like that?
So, yes, public health preparedness is also another area of expertise. So, just as you would prepare for, um, you know, preparing for a hurricane,
Hmm.
preparing for, and even relief, that is all
Right.
part of public health as well. Yes.
Okay. And this is kind of a government promoted corporation, right? Or how would you call it?
I would say there are multiple layers of public health partners that you can work with. So at the state level, you have state health departments. So for example, the California Department of Health or the Texas Department of Health, and every single
Mm,
state has their own version of what they define as their state ran public health agency. You also have something at the smaller, more like zip code level public health interventions, and this is more community based. You have something like, for example, like Los Angeles County, San Mateo County, or just any county that you can think of here in Seattle, King County. Um, and surrounding areas, they all have smaller health departments that work more at like more community based level,
mm.
and work with addressing issues at the community level versus like statewide. And then you
All
have
right.
federal, which is then addressing nationwide at that point.
Mm. It's I some of the diseases that have been around for years are also from mosquitoes, and you know it almost seems like this is a never ending problem. And I think I saw this somewhere, but that they were trying to eliminate all the mosquitoes and then try to, because they can also be essential to the environment, like flowers and pollen and all that.
Mhm.
They decided to make, I don't know if they're already out there, but I I think they tried to make some artificial mosquitoes. And obviously, mosquitoes carry some diseases. Do you think that's ever gonna come to an end, or it's gonna go down, or what are your thoughts on that? On that?
It's kind of hard for me to say. I don't, um, I don't have necessarily as much that I can weigh in on that, but at least I know I do believe in climate change, and I do believe
Mm,
that the way that our um, that our different ecosystems can really be impacted by it. And one of them being, I think, things like vectors, such as mosquitoes, even bees. If
oh,
everything
really?
is there. There are some that are. I mean, this is just from my own personal readings that
Mm-hmm.
what I've understood, but I'm not too familiar with the artificial mosquitoes, but definitely would be something interesting to explore and see how that could help the impacts that we've had already from climate change.
Mm.
I
Is
think that
climate change, can that also fall in a bucket as a public health advisor?
climate change
Yeah.
would, I mean, you definitely recognize climate change as a um it as a way of impacting health as well. Yes.
Right. Right.
Yeah. you
Right.
you
Because
do you can notice that.
and I mean, because when I've talked to a lot of people, and some of them would say that, well, back in California, that when they were living, and it was like early in the 80s and 90s, it used to be outside used to be so full of smog that you almost couldn't breathe. And obviously now it's gotten better, but it's something that we're not there yet, and
Mhm.
it sucks because there's some people that almost don't believe in it, or they have their own beliefs and their own biases on it. Is so what are you guys doing some things to help to promote climate change and climate change awareness?
Well, I think that there are different efforts, at different levels. So, at the community level and also like states, but really if you look at, I think, and I again don't have necessarily the stats on it, but if there are, if you look at the rates of, you can basically look at, well, how many people are suffering from diseases that impact the respiratory tract, and then
Mm-hmm.
realize that some of that could be an impact, or a result of you know different things that we are breathing in our environment. Also looking at, where do people live, work, and play, so your built environment. So um, do these folks that are being impacted with higher rates of respiratory diseases, do they also live next to an unhealthy factory that's
Right.
having different emissions? And that's all what public health is
Mm.
just looking at all of these different things that you wouldn't think impact your health, and unfortunately that are sometimes, sometimes our most vulnerable populations are the ones that suffer, um,
Right.
because they have no choice but to live in these areas. So I think public health is also a part of looking at making sure that these, marginalized communities, or that these, most vulnerable elderly, or, folks that are already, not, are already, maybe more likely to become ill in the future, are being protected as well, and with policies and changes that will help enforce how much these factories can actually let out,
Right.
spillage, whether it's in the air. So I think that that is another component of public health, and what it is
Mm.
just
Right.
many different layers, or many different factors and
Right.
determinants.
And
Mhm.
back to the mosquito part, it's it's crazy how now how we're all scared of this. If we were to see a huge animal like a tiger or a lion or something like that, we would be automatically scared. But then again, the small animals are the ones that you can't see, or the ones that you could barely see are almost the ones that are the deadliest,
Mhm.
and um what kind of is there, like when they carry a lot of bacteria, right? What are some of the things that you advise to people to look out for in that sense?
So for, I guess it would just depend. So I remember just going back to our, like, the days of, working in a response that involved, mosquitoes. So for example, like Zika, then you want to focus on repellents, and advising and providing recommendations to people, and make sure that things as simple as, not going out when it's dawn and dusk, because that's when mosquitoes are most active,
Mm,
wearing long sleeves if you are going to be outside, and also prioritizing things like bug repellent. So I think that it's those types of recommendations, I would say. I guess it would just depend on what small animal you're working with, you're dealing with, and maybe provide some recommendations that are specific to that particular bug or vector, whatever it is. And because I think I'm by no means an expert on dealing with small vectors. So it's definitely something that is good to know. But at least for working with mosquitoes, I remember providing those recommendations. Just
mm,
you know long sleeves, using repellent, and avoiding dawn and dusk hours to avoid getting bit at that time.
right. And as what are some of the things, or what made you go on this journey of, did you always have like this thing that you wanted to be but wanted to get public health, or how did that come about?
So I uh it's funny you ask. So I I'm looking back. So I actually started off thinking that I wanted to own my own business or be
Mm,
some kind of business management role. After, a couple semesters in college and realizing that that wasn't really my exact fit. I'm also a pretty indecisive person, in the sense that I have just such a mix of interests that I want everything all at once. I want everything all together and find the perfect balance.
right.
So I think I was mentored into discovering the opportunities that at that time. Um, so I went to school at Cal State Northridge, and at that time, my advisor and started to tell me to explore a little bit more in what my interests were. And surprisingly, since I was pretty young, I actually really enjoyed anything that had to do with the medical field. But at the
Mm,
same time, I knew that I didn't see myself necessarily as a clinician or a doctor, but I thought, being a physician's assistant would be nice. I think that would be really interesting, or a nurse. So I started exploring after, business school wasn't working out for me. I decided that I wanted to explore PA school. And my advisor at the time said, "Have you considered anything in public health? We have a public health education program here. You should look into it." So, sure enough, I did my research and realized this is it. This is exactly what I've been looking for.
really.
So public health, I realized, combined social justice. It combined the medical field. It combined, everything that I loved about promoting and educating others
Mm,
about healthy behaviors. So I think that was a turning point, and I realized that that's what I needed. So I started my journey then.
mm. Now, after doing all that, was there some jobs that you had to go through before you got to the CDC, or was it straight to the CDC after all your studying or all your classes?
So I ended up actually, as soon as I finished my undergrad, I decided that I wanted to go and go for my graduate degree. So I did my MPH at the same school that I was working at. I started getting involved in some research assistant positions. So I was able to work with one of my professors at Cal State Northridge really closely. And she really encouraged me to apply for different fellowships and opportunities in the community. So I was able to work with her as a research assistant, but then also at the same time discovered a fellowship that CDC was offering for recent graduates. So I went ahead and applied, and said, I'm going to throw my name in the hat and see what comes out from it. So I was selected to be part of the CDC Public Health Associates
Wow.
program. So I was a class of 2013 associate, which basically was a 2-year fellowship. And what that did was kind of set you up for anybody who for anybody who wants to be work in the public health field. It gives you 2 years of exposure of working in um, local public health settings. So I was assigned to the LA County Department of Public Health at that time for 2 years. So I finished grad school, was doing my fellowship full time, and then once the fellowship ended, I then decided to apply for a position with CDC, and then that's how I was able to then get started in Hawaii, and then move to Seattle eventually.
Nice. What does the training in public health? Is that more of a hands-on? Is that more like a data entry job, or what kind of training does that look like?
It really depends on what your interests are. So if you want more hands-on, then I would say something like public health preparedness is a perfect opportunity for you to be able to do more hands-on work. So with you having the ability to work in the field, and actually work in the community, you are able to do that. If you want more of data entry and analysis, then you can do a little bit more like epidemiology. And epidemiology, at the same time, you could also do a lot of field work, because you're essentially investigating what is the root cause of what is causing illness in the community, and study disease patterns. And you can also be a health promoter and health educator, so work in a classroom. It really is just whatever you think your passion is. Then you can pursue it in
Hmm.
that particular way. So I think that the position that I'm in right now, it allows me to do a little bit of each of those things. So I'm able to provide guidance to state and local partners and other federal agencies that we work with. I'm able to, you know, enter cases, and look back at the data and decide what it is that we need to improve on. So a little bit more, that's how we kind of look for gaps and things that we might need to improve. But then also look at you know actually responding to illnesses. We are able to do that as well. So I really get to do a little bit of everything every day. So it's been, I think, keeps you on your toes.
Have you gone back to your original idea or thought of kind of being a entrepreneur and starting your own thing, or has that just gone out the window?
I'm not opposed to it. I'm not opposed to it at all. I think that the idea is still there. I think really narrowing it down to what that would be and something that I would actually enjoy, is what I probably need a little bit more thinking on, to more planning and thinking on. So I think that that's, maybe something for the future. I think that I would love to do it still. Yeah, I just have to decide in what.
Right. And with where, like, for instance, like the COVID thing, this is something that was not only statewide but worldwide. Was this
Mhm.
something where there was travel that was needed for you to go visit other states or other countries or anything like that?
So when the pandemic hit, I was here in Seattle, and because there was so much going on, there was a lot of help needed here.
Mm,
So I did not have to travel anywhere for work. I was able to stay here, and actually just focus on the response here locally. So we had plenty to do. We really did, and so it was a busy time, stressful time, as it was for so many professionals, across the nation and around the world. But we, at least for me, they needed all hands on deck here, it locally. So we were not sent anywhere to help assist. But I definitely know colleagues who deployed to my place of work. So they actually were helping us because we there was so much help needed
mm,
that other representatives from CDC actually were able to come and assist our response here.
right.
Mhm.
And I would imagine this is kind of a thing that you guys have been studied for, trained for. So I would imagine that these type of pandemics and this type of outbreaks would be almost like overtime, like like I don't know, just like overtime, or you can really put everything that you learn and everything you study to the test.
That's, yeah. So I feel that, you can, this I would say was probably the biggest response I've worked on since being with the agency. I also was never only in infectious diseases. So this was, I would say, like a very good, um, you know, exactly a good opportunity to really apply everything that we've been practicing for and that we've
Mhm.
been, trying to establish as far as like preparedness and communicable disease preparedness, essentially. and working with our multiple partners that we typically work with every day, but not in this capacity. We work with them with other diseases and other cases that we work on, but not necessarily a pandemic. So being able to do that, I think was really an eye-opening experience.
With public health, even though these are some diseases that are kind of considered as, as outbreaks, is there like kind of guidance as far as, exercising, eating healthy food, taking your vitamins and stuff like that?
There are, yeah. So, and most of the recommendations you hear, they are in some way, shape, or form, basically developed in order to target different segments of the population. So, you know, different recommendations, will be, I guess it depends. So whatever you're looking for as far as, you know, physical activity recommendations or ways that you can improve your diet, those are all things that, yes, CDC is definitely one of the bigger agencies that provides recommendations on that. But
Hmm.
if you also look at FDA or USDA, they do have different guidelines for things such as like portion sizes and what we are actually consuming. So there are a lot of different agencies that can provide guidance and recommendations for what you want to achieve. But yeah, definitely for physical activity, I would say there is a lot of guidance out there that you can find for what's
Right.
recommended for different age groups. Um, you know, do you have an existing condition, or different, a lot of different things can really play a factor in what's going to suit you as a person.
Right. And in your position, you're kind of like, as an example, like as a nurse, someone that's there on the line. And when you see a nurse, or when you know a nurse, once they go to the hospital, it's bound to happen where they're gonna get sick and they're gonna come home and they're gonna get everybody infected. Just like how it was happening with COVID. If somebody was in the hospital during COVID, it was almost 100% that one, they're gonna catch it, and two, they're gonna come home and bring it, with you and being in the line of work. Um, how much or are you guys like cautious about that, or how prepared are you with that?
So just as you probably remember seeing, there are so many people that are healthcare professionals, and they are, you know, basically you have to wear PPE in order to
Hmm.
protect yourself as much as possible. So that applies to me as well. So I don't work at a hospital or I don't work in a clinic setting,
Right.
but because I am around so many travelers, so I work at the airport, and so I end up coming across many international travelers. So we are required to wear, PPE as well, and protect ourselves as much as possible. And so yes, that is one way that we, I guess, can lessen the risk,
Mm-hmm.
and prevent ourselves from getting infected as well, while continuing the work that needs to happen, but helping as much as we can and having a presence there. But we are also asked to wear PPE.
Right. How long do you think this COVID thing will die down? Or do you think now that we got the vaccines going, I mean, it's gonna, if it might still be there, but it's not gonna be as explosive as it is now? Or
Mhm.
what are your thoughts on that?
Yeah, it's really tough to say. And I can't say for sure, when it'll be completely gone. I think that we're moving in the right direction. And that's just my personal account saying that. Um, I, I think that it's, I think it really takes, collective effort to get to where we want to be. So if we all want to really achieve, to be healthier and, get through this, I think that the same amount of effort needs to happen, I think, from all sides. So I think, yeah, it's kind of tough to say. I can't, I'm not sure that I really know when, but I think that we've made some really big accomplishments already, big strides,
Mm-hmm.
such as administering the vaccines, and I really do think that that's going to help.
Hmm.
I'm feeling
And I
hope.
mean, looking back, diseases and both bacteria have been around for thousands of years. And even, thousands of years ago, even simple bacterias or even like things like the flu and stuff like that, um, you know, would would kill people. Thankfully now that we've kind of been more innovative, and there's more science, obviously, that has gone down. How do you how do you think the future is going to look?
I think that with there being, I mean, if we look at everything that has happened with COVID, I think we're really looking at things in a different perspective. So it's made us change literally every aspect of our life.
Hmm.
So if we look at how healthcare has changed since the pandemic started, we're now, big proponents of telehealth and being able to do
Right.
everything virtually. So I think that with the advancement of technology, and in healthcare and in everything else, I do think that it's going to, in a way, impact the way that we um, deliver healthcare and deliver public health um, significantly. So I do think that the pandemic really caused a big shift in the way that things will look in the future. It's early to tell how exactly that will be, but I do honestly feel that there will be some shifts, and we'll just have to see what those are once we face them. But I do think that it's the pandemic has shifted a lot of the way that we do things.
Right. Yeah, I feel like the pandemic has really become an eye opening for a lot of people, a lot of companies, and it kind of has I feel like it kind of has pushed us to be even more innovative. Like, we were slowly climbing up, and now that we got COVID, it's like, okay, just like the vaccine, there's many vaccines in the past that take years of research, years to of data gathering, just to know that it's 100% effective. And we're a little bit over a year with this COVID, and the vaccine's already out. And just by that, it the COVID has really pushed us and puts pressure on us, just to get the vaccines out, like you said, to be health. And it's crazy because even before, simple stuff like washing your hands, or not touching things that are
Yeah,
dirty. A lot of
right.
people that I know would not do that. And some of them would even be a little bit upset that now is the time that they have to do that.
Yeah, absolutely. Yeah, it's just like reminding everybody of just these simple recommendations that can really make a difference. Something as simple as washing your hands.
Right.
So it's little things like that.
And
So
even washing your hands, this is something that has been proven. I forget what disease it was, but I mean, this is one simple thing that you had to do back in the day in order for you not to die. Just wash your damn hands. And some people just eventually, I don't know what mentality they're in, but they just stick to doing whatever they want.
Yeah. Yeah, I know it's again, I think that COVID has really shifted people's perceptions on that. And again, these small little changes and habits that for so many have been ingrained in our minds since we were children. It's something that I think will continue to be promoted, but I think in a way it's probably nudged people a little bit more to like be more um, careful and to think about things. Something as simple as like giving a hug, when you're sick, or staying home from work, when you are sick, things like that. It's what now, again, I think is part of just how a lot of people's perceptions might end up changing, and employers included, really schools, so many places
Right. And
change.
because you are like pretty much in many cases front of the line when stuff like this happened, what are some of the things that you feel helped you stay healthy? Because I mean, from seeing, like, I mean, I could only of what I've seen on Instagram, you seem fit, you seem healthy, you're out there being active. What are some of the things that you feel have really helped you to stay healthy and active?
So I actually have I do really enjoy staying physically active. And before COVID hit, I used to love to sign up for races here and there, just go for a run. I used to love to run all the time. Um, all of that just kind of also just developed. I developed it over the years, but I wasn't always a big fan of running. In
Oh,
fact,
really?
probably in middle school, I hated it. When we had to do the mile run, I would, oh gosh, avoid it. Probably get like 12, 13-minute miles, if not worse. And then decided to, kind of change my lifestyle a little bit in college. I wanted to be a little bit more, mindful of my health, and eating better. So for me, I love running. I love anything outside. And I think being here in the Pacific Northwest, it really helps that it's, you can find a trail just an hour away from here. You're never too far to just
Right.
be able to do something, camp, or, something, anything, but just always be moving, always just be active. I get a little restless when I'm just like sitting down, and but at the same time, I
Right.
think COVID also taught me that it's okay to slow down, and you don't always
Mm,
have to, it's okay to kind of do things when you have time, and when they're right for you. Don't feel obligated to do it, because if you feel obligated to do it and you're not having fun, then it's not you're not going to maintain your
right.
lifestyle. So do whatever makes you happy.
Right. So COVID has kind of affected you in a way that you had to slow down and take a break.
Yeah, I think it did, because initially, especially, it was you were working long hours. I realized that you're putting so much work in that you also had to find that balance of like checking in with yourself and making sure that you're okay, in order to continue your work. Um, and and I think that so many people around the world are dealing with much of that, and realizing that um, you now have to find and make clear boundaries of when you should work, when you should play, and exercise, and what does play actually mean if we are not able to do most of the things that we were used to doing, and continue a lot of our regular lifestyle, activities. So I think that yes, it taught me to slow down, because I now had to find interest in doing things that were just here at home,
Mm-hmm.
cook up new recipes, or do a puzzle. I don't think I had touched a puzzle since I was a kid, probably. So again, yeah, COVID definitely taught me to slow down. So because if even if I wanted to go outside, it was probably pouring, as
Right.
so I just had to stay indoors and do home workouts or something here.
Right. And I
Yeah.
mean, just hearing you talk about everything is, I mean, I'm already gaining a lot of knowledge from you. And what are some of the things that you remember that, really became an eye-opening or even enlighten you, whether it might be in school or even in the field?
I think getting to see people who were already working in public health before me and seeing how much they enjoyed their job and how
Mm,
passionate they were, I think really motivated me to always keep sight of that and never lose what really motivates you to do something. And I think not be afraid to take risks, because at the end of the day, you're if you don't take them, there's less of it. You won't have a chance to actually, you'll have zero chances instead of a percentage. So I think that um, one of the most eye-opening things I would say is just ensuring that you always have something that you're working towards and always open to learning new things. Like, in my opinion, the day you stop learning is really the day that you've kind of given up. Or
mm,
I think there's always room to learn, there's always room for improvement. You can always do something, but you can always find a way to improve, and
right.
so by no means do I ever strive for perfection, just like ensuring like continuous learning and improving and expanding, um, like your way of like uh, doing things, or just improving in general, whether that be
Right.
something as small as the way you think, the way that you brush your teeth, maybe you floss now, something. It's the tiny things, tiny details really do matter. So when I was
Mm,
working for LA County, I actually was able to know, um, basically how it works is, whatever you work at like the county level, it's all information that you work with, and basically it's really important information that can be and can create different policies and also work, so that it impacts at a federal level. So I've had the opportunity to work in both. So having that, I would say, has has really provided me with just never losing sight of, sometimes what you think, I miss it sometimes, because you can sometimes realize that it's what you um working with others is really one thing that I've like appreciated the most. So
right.
I've gotten to work with, county health departments, and knowing how that impacts, situations at the federal level. I think that it's given me like an opportunity to see both. So I would
Right.
say just having that experience has been really eye opening for me.
Right. And I would say that that's one of the great things about doing what you're doing is that it's something that's very community based,
Yeah.
where no matter what community it is, whether, it's, people that live in poverty or the people that don't, you're in the community and you're out there helping one another.
Yes. Yeah, and I would say, and at the community, and also it's expanded my knowledge, and experience working in global health too, which is, another interest of mine. And realizing that really everything that we do, here, in our comfort, in our country, really can also impact the way that, you know um, the way that health is linked, I think, abroad, and like
Mm,
with, you know, globally. So even though, we may not think that or associate that, but yeah, like health is definitely linked. at these different levels. So it's given me, I think, that perspective. And so for that, I'm super grateful. And I think that's one of the greater benefits that I could say I've had in working in as a public health advisor, is just being able to see these different levels of work.
Mm-hmm. Now, and right now you're a public health advisor. Is there another role to that, or is this where you're planning to just stay?
I'm I don't think I'm opposed to exploring different options, but I think that thankfully this role can allow you to do different, basically to assume different responsibilities, even as a public health advisor role. You can do project management as
Mm,
a public health advisor. You can do, more program design. So it really would just depend on what next avenue I want to pursue. But I do think that for the time being, I really do enjoy it. But perhaps in the future look forward to doing more project management, and
mm.
um, maybe something like that, or get back into some health education, which is what I actually went to school for, and maybe get back into some teaching roles or something
Mm.
along those lines, which would be neat in my opinion.
Is there any misconceptions about your role or about things that you try to promote that you kind of constantly have to be picking at?
It's a good question. As far as misconceptions, I think that for the most part, I don't know if I can say misconceptions, but
Mm-hmm.
less awareness of
Mm.
what my role is, and what
Okay.
even in general public health is. So I think that a lot of the time you sometimes explain what it is that you do, and especially because I don't think that it's widely known that there are different levels of health agencies. You can work, again, local, state, federal. You have non-governmental agencies. These are community-based organizations. There are so many different players in the public health field, that I think differentiating in like what each one does is what you end up explaining when you work in public health. And as far as my role, I think it could be a little difficult for someone to understand that I work, in a setting where it's CDC, but I'm not headquartered at CDC. I'm in the field. So I think
Right.
explaining that is a little different for most
Mm.
people. Yeah.
Now, and then you went from Cali to Hawaii to now Seattle. Do you think this is a role that someone needs to really enjoy actually traveling versus just staying at home?
Yes, I think that you do have to enjoy traveling. I think, and I think that not being afraid to, again, take a small risk, and just put yourself out there with not really knowing. I moved to Hawaii. That was my first time ever visiting. I had never even been there for fun, and I decided to go there my first time to move there and live there. So I think that I always knew that I wanted to live somewhere else and
Hmm.
explore. Again, not because I don't love California, but because I felt that it was important for me to be exposed to different things and struggle a little bit. I
Right,
think be challenged. I don't think that I personally grow if I'm not challenged, or if I'm not like seeking a way to like learn something new. So I wanted to get out of my comfort level, and
right,
something that I knew I didn't have any friends in, didn't have any family there, but I
right,
wanted to still check out and see what it was. And at that time, I think it was also important because I was exploring this area of public health that I had never worked in before. I had always worked in chronic diseases. So my passion was always more like obesity prevention, physical
Mm-hmm.
activity, and focusing on cardiovascular health and things like that. I to this day it's still my passion, but I wanted to do something a little bit more, again, outside of my comfort level, and do more communicable diseases. So I switched and just decided to go with it, and it ended up working out. So I think that yes, if you are interested in exploring, or just trying a new job, don't be afraid to take it if it's out of state. If it's something that you want to do, you don't want to regret it, years down the line, saying, I wish I should have taken that job. It was only for a
Right.
year or two, or maybe you end up staying there and building a life there, but you just won't know until you try it.
Right. And when you were working in the field to prevent obesity and stuff like that, what were some of the things that you would promote to individuals that were fighting with that?
Yeah. So believe it or not, I actually was a research assistant for a breastfeeding study. And at
Oh.
that time, it was a research project. And the professor that I was working on was a lactation consultant. And uh, basically, I learned so much about breastfeeding, learned that it is also, uh, a way to help reduce childhood obesity. And
Hmm.
so that, I would say, was my first introduction into obesity prevention. And at the same time, another project I was working on was teaching physical activity at different elementary schools, at low income elementary schools, because at this point, in LA County, the childhood obesity rates were basically at a
Hmm.
pretty high level. So we would target, these communities that had low income, mostly minority students, to be able to promote healthy, more physical activity, and how to do that
Right.
given the constraints of their environment, given the constraints of everything, socioeconomic factors, basically all determinants of health, which really include all of that.
Right. Yeah, I would say, I mean, that's always a tough topic because even if you wanna eat healthy, it can be so expensive.
Definitely. Yeah.
Even like I remember doing during COVID, I was driving and I was hungry, but I didn't. The closest thing that was to me was, of course, McDonald's, and I said, you know what, fuck it, I'm gonna go to McDonald's,
Yeah.
and this was during COVID, and I said, okay, fine, I'm gonna try to get the healthiest thing that I could find on the menu, and I asked for a salad, and they were actually not serving any salads during COVID.
Really? That's a
Yes,
surprise. Did
yes,
they say why?
because of COVID.
Okay.
Yeah,
I I hadn't heard that one.
yeah. So I mean, they can't sell salads, but they were able to sell you Big Macs and double quarter pounders, and all these huge. And I'm like, how does this even make sense? You
Yeah.
know,
I wonder how that rule, like how it was decided that, certain things could be sold, but not others at that point.
right? I think you should go visit McDonald's sometime and really
Yeah,
promote the stuff. Yeah.
yeah, I'm really interested to know.
In
Um,
Hawaii, did you learn their language?
I didn't learn much native Hawaiian, but there is something called pidgin, if you've heard of it. So
No.
basically, it's a way of combining, like, English and Hawaiian all together. And it's just a very it's a unique form of speaking that's native there to Hawaii. So I was able to pick up on a little bit of pidgin, or at least understand if someone spoke it to me. And so there are certain words that are thrown in just normal everyday conversations. So I was able to pick up on them and at least follow, and know what someone was asking or telling me. So it was really neat. I also didn't have a car in Hawaii, so
Mm,
I got to ride the bus and got to know the island really well, which I actually recommend. I
that's
decided to leave
cool.
my car here in, or in California at the time, and just explore, just take it easy, live the island life, and not have a car, and
Very
would do
cool.
most of my exploring and outings, um, on like the off chance that I had to like rent a car and just explore the island. But it was a good time.
Right. What other place would you want to go visit or live?
Hmm. Oh gosh, I know we all want to travel already. We all are ready to
Like-
go on a plane.
yep. Yep.
I would say anywhere sunny and warm right now. Sunny and beach and warm. Um, Gosh, but as far as living, I would love to explore Spain or Italy
Mm.
to live in.
Oh, really? Is there any
I've never
particular
been.
reason?
I think just the food, the culture. I think it's something that I would enjoy, and I haven't visited either place, but I think that I would enjoy it.
Right.
So
Now,
somewhere,
where do you think this mentality, this mindset comes to you of just willing to risk it and change or explore?
I think I think a big push, a big motivator is the fact that um, I have a very supportive family, I
Mm,
think. And I think in like a Mexican family, first generation, you can sometimes find that, and this is not by all means across the board, but I definitely have gotten to know that in some situations, we're very close to our families, and sometimes at the same time, it could make it a little bit difficult to leave that behind and feel like you are putting aside your family to prioritize you, in a way. We look at it as being selfish, or we think that others will perceive it as being selfish. So from, I think, being a first generation, um, you know daughter of immigrants, my parents actually were the ones to say, I do think that you should do everything that you want to build
mm,
your career. We
okay.
support anything you and my siblings, anything you guys want to do, we support it, as long as it's, you're studying hard, you're working hard, and really building a future for yourself and eventually your families that you would establish. So, whenever we decided to go away for college, they were supportive of that, even though it wasn't going to be just down the street, or it wouldn't be necessarily, 1 or 2 hours away. So, with, I think, that in mind, it helped us, I think, feel more confident in our decisions to be able to do that. For myself, I think that was a big push, in that knowing that I always had like my parents to say like, okay, like, that's great, continue on. We're not feeling bad that we're not going to see you in a month. We miss you, but we know that you're off doing what is right for your life right now. So
Very
I think
cool.
having that support was really helpful. So yeah, I would say that was one of the things that
Yeah,
helped.
I wonder because I'm in the same boat as you two. Where, I mean, my parents came, even me. I mean, we all came from Mexico, except my dad came here first. He got us all settled, and then he flew us in. He flew
Yeah,
us in once we were already, good to go.
right. Yeah.
And I wonder if some of that has to do with them already knowing that sometimes you have to do what you have to do, in order to do the things that you love to do or even to provide. Because, even when I told my parents I was coming to Texas, they were a bit upset and a bit sad. But
Yeah.
I think from just having that mentality and, in back of mind that they had to also leave Mexico for something better,
Exactly.
we're trying to do the same thing. Now we're trying to go from California to Texas and kind of start our own journey, you know, and with
Right.
our own family and kind of provide all the things that we want to do. So I wonder if that's something that is just in back of their mind, that sometimes you just have to do what you got to do. And if and it's, yeah, like you said, it's important to always have the support system to at least, if it all fails, you at least have someone to come back to.
Yes, that's so true. And I think just like your parents, they're respecting your now decision to move on and start your journey. So I think that yes, I truly feel that in a way they're thinking, you know what, maybe they weren't able to pursue like their exact career goal, their exact educational goal. So they're kind of opening that path up to you to now do that and make sure that you at least have that opportunity, which is in many ways the reason why they decided to move here in the very beginning was to provide that opportunity to us, for our futures. So I think that in a way, like it helps, to then see your parents, be appreciative and so grateful and probably proud of you to have taken that leap and decide to move your family to, to Texas and um, to then be able to talk about it, oh, it was hard seeing you go, but I'm really proud of what you've done.
Right.
Yeah.
Right. And to your point, that you sometimes you have to struggle, and sometimes, if you're getting so comfortable, sometimes, if you don't, I don't know, sometimes I feel like if you don't create your own struggle, the struggle will come to you. And sometimes it's a lot easier and a lot better if you kind of create your own struggle, because I would imagine it was a struggle from you, just trying to adapt from California to Hawaii and now to Seattle, to adapt and start
Mhm.
your life over, two times already.
Yeah. Yeah, that I mean, definitely. There's because I think there's a learning curve anytime you move
Mm,
somewhere, right? You got to know what the culture is like, what's acceptable and what isn't. What do people do here for fun? Is it in line with what I do, or do I need to seek out, what exactly it is is gonna be my thing to do? So, yeah, I feel that here, at least, you typically hear the Seattle freeze. I don't know if you've heard about that, but basically it means that sometimes, people already have their circles of social groups and circles established, and sometimes it's not as welcoming to like outsiders coming in or transplants like myself. But I really do think it's what you kind of the way that you seek out different opportunities to network, different opportunities to meet people that can really shape the way that you um, experience a new place that you move to. So I was fortunate to meet, I think, a good set of friends here that actually were a lot of them were from California, and we're
mm,
also just looking to find each other and, a place to network and a circle that in many ways related to each other. So I
right.
was able to find that and network also through, alumni groups that for, my school and also for my fellowship that I did back in the day. So it helps to just like seek out those different opportunities and just get out there. It's not
Very
always
cool.
easy, by no
Yes.
means. It's not always easy because I, in many ways, can be an introvert, and so it's not easy.
Yeah.
I'm happy in the comfort of my home, and I'm good with that. But it's good to also like network and like get to meet.
Yes. Yes. And
Yeah.
I didn't really get it didn't really hit me in regards to your network, till somebody asked me about it. And like you said, it's super important. and you don't really realize it till you're already out of it. And here somebody asked me from Cali, oh, how do you feel about leaving your network behind? And I was like, oh shit, like I never thought about that.
Yeah.
For some reason that was not the thing that I thought about, because I had my wife here, I had my kid, and at that time that's my network, that's it.
Right.
But
Exactly.
eventually you do build it, and like like you said, it's a struggle, because you have to you kind of have to build that network again, and you need to be able to adapt, and like you said, find out what these people are all about, what they do for fun, what they like, and just trying to find where you can both meet in the middle.
Exactly. Yeah. Adapt is a good way. Adapt and realize at the end of the day, is it a good fit for you? Because
Right.
you can go somewhere new, you know, find it thrilling at first to experience, just pick up and leave, but then you're there and you're like, you can't seem to find a way that you like can make it, happy, and be like stable, and be happy and enjoy it. So yeah, it's work.
Yes.
Being moving to a new place is work. Not only like moving your personal belongings and in your family in your case, but definitely everything else. So like the social aspect of it is a big part too.
Right. Right.
Yeah.
All right, Myra. Well, let's wrap this up. Is there any important things that you feel like the audience should know?
No, I mean, I really just thank you so much for inviting me on. I think that this is a really cool platform you have, and I'm just really glad that you gave me a chance to talk about public health a little bit. Again, I think with this year being what it was and last year being what it was, you've heard a lot more about public health, in the
Yes.
news and pretty much in every inch of our lives. So thank you for allowing me to kind of share a little bit about myself. So that's really all I have to say. And um, you know, just it was really nice being here. So thank you. And it was nice
No.
catching up with you too.
Well, thank you, Myra, again. And, I appreciate you coming on. I really do. And I'm glad that, you were able to share your experience, your knowledge, and kind of what, public health advisor really does and what it's about. And, you know, one of the goals I hope one day will accomplish is that somebody will see, this podcast and really motivate them, and really look into someone that might have been confused at the beginning, and they not now they hear you and they're like, hey, that's exactly what I want to do. I
Yeah.
want to be like Myra, and
Oh,
so
that's really
again,
fun.
thank you
Thank
very
you.
much, and good luck, and
Thank
have
you,
have
Omar.
fun in Seattle.
Thank you. I will. I will definitely try. Thank you all so much.
All right, you're welcome,
All right.
thank
Good
you.
seeing you.
Bye.
Bye.